Welcome to the 5-Second Rule podcast. We are your hosts. I'm Lerenza Howard, and my preferred pronouns are she, her.
And I'm Kelly Holmes, and my preferred pronouns are also she, her. Today, we're diving into the content of the upcoming International Infection Prevention Week. And we have two amazing guests from APIC's Communication Committee to talk about this subject with us today. And I'm really pleased to introduce our first guest, Michelle Swetky. She's an infection preventionist at Fred Hutch Cancer Center in Seattle, Washington. Michelle has a decade of infection prevention experience in acute and ambulatory care with extensive experience in an oncology setting. She's passionate about expanding the field of infection prevention into the ambulatory setting and across the continuum of care. Michelle has served as the chairman of Comprehensive Cancer Center's Infection Prevention and Control Group from 2021 to 2023 and is a current member of APIC's Communications Committee.
And Tammy Cunningham is the Infection Prevention Manager at AdventHealth Kansas City Region, overseeing the infection prevention programs at 3 acute care hospitals and 2 freestanding emergency departments. She is active in the Greater Kansas City APIC chapter and is currently a member of the APIC Communications Committee. Tammy is board certified in infection control and is passionate about preventing infections in patients, especially CAUTIs, CLABSIs, and C. diff infections. Welcome to the show, Michelle and Tammy. So, of course, as Kelly noted, this is one of our very fun episodes of the year highlighting International Infection Prevention Week. So, Tammy, tell us first more about IIPW and what are some of the main goals of this year's, theme and the initiatives that the communication has constructed for us.
Well, the APIC Communications Committee has met to discuss the different themes for this year's International Infection Prevention Week. And when we met and just sort of brainstormed about it, we talked about the different roles that infection preventionists wear. We have many different hats. We come from different backgrounds. There's nurses, there's infection preventionists that worked in public health. We come from different facilities such as acute care hospitals, critical care, long-term, and even correctional facilities. And so we want to make sure that we branch out to all the infection preventionists and unite as one and provide different resources for them. And then we also want to reach out to all the different ancillary departments that we interact with, such as lab, EVS, sterile processing, surgical services. And so then we ended up coming up with the theme of Stand Up, which is standing together, we unite, prevent, protect, prevail, and then stand up. And each day during the week has a different theme to it.
Thank you so much, Tammy, for your insights. Michelle, can you share additional insights related to this year's IIPW theme and some of the priorities that the Communications Committee has constructed for this year's priorities for IIPW?
So I have to say, when the APIC's Communications Committee met to discuss potential themes for this year, the conversation carried a very somber tone. Infection preventionists are facing new challenges, ranging from shifts in funding priorities to evolving public health perceptions of public health guidance, creating a sense of uncertainty in the field. So we really wanted a theme that would be uplifting and focus on supporting IPs. So while also highlighting the importance of collaborating with other ancillary services. So our message is clear. We are united, working together to keep patients and healthcare workers safe. This is why this year's theme is Stand Up for infection prevention, and that is up with 3 Ps. So it's stand up, 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 up. And that stands for unite, prevent, protect, and prevail. So we really wanted to bring infection preventionists together this year.
I love that. Yeah, thank you so much for sharing. And I love the stand up, 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 up. And I can almost hear you guys laughing when you were coming up with that very clever name. So I know that every year the committee really works hard to come up with interactive themes and engaging content. So can you walk us through some of the key activities that APIC has planned for IIPW for 2025? And then how do you envision IPs utilizing these materials?
Yeah, so I think we as the communications committee really want to make these materials a real easy grab and go for infection preventionists, right? We know how busy that they are just in their routine every day, let alone a full week of celebration. So we wanted to create these tools that they can just grab and go and bring it to their frontline staff, so everybody can celebrate. So every day of the week has a theme associated with one of the words, like Monday's Unite, Tuesday Prevent, moving on to Protect, Prevail, and then finally Stand Up, wrapping it all together. And every day there's a message for IPs. There'll be a recommended activity associated with the theme, as well as promoting some of the resources that APIC and other institutions have that they can then share with frontline staff, as well as the ever anticipated Wordle of the day, and also trying to promote the IP factor in social media. So again, things that IPs don't necessarily need to put in a lot of extra work to then move forward.
I love that. That does make it very easy for IPs to just grab the ready-made resources and roll with it and be able to have some fun at the same time. Tammy, did you have anything else you wanted to add?
So Michelle did a really good job of explaining everything that we have planned for the week. Like she said, every day has a different theme word that goes from the stand up, 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 up. But we have different activities, like she said, the Wordle. So the Wordle will be related to those different themes that we have. There will be different resources. We have a Beat the Bugs crossword puzzle one day, different things, resources that are even online, like infection control scavenger hunts or CDC Solve the Outbreak. So a bunch of different ideas and activities. And then, like you said, Kelly, they are online and available for all IPs to grab and share amongst themselves and with the frontline staff.
Thank you for sharing that. And I think it's absolutely integral. I'm pretty sure it's going to cause some competition, of course, with the famous Wordle annually disseminated. And of course, doing it amongst ourselves as IPs, but also garnering the insights and, sharing the fun with the other ancillary and clinical departments as well. So, of course, we love this episode, as I previously noted, and the theme this year is ever so befitting of the current times. So I'm curious to know and share with us, Michelle, how the communications committee comes up with, how did they come up with this year's theme? What was the thought process behind that, aside from what you previously noted?
Yeah, well, as Tammy mentioned, we really want to make sure that we are supporting and celebrating those ancillary departments that we also work with as IPs, right? We really want to feel united, especially with this ever-changing landscape. And we know that accessibility to resources may be limited this year. So we really wanted to highlight how we feel about our infection preventionists, which they're superheroes, right? They're working to collaborate with so many other individuals, and they are working behind the scenes to prevent infections. I think something that's always stuck with me is if we're doing our job well, you never hear about us, right? Because you never get those outbreaks, right? You're always preventing those things from happening. So I think we're going to have some really fun material this year, including a lot of our graphics are going to have IPs as superheroes and standing up together, as well as some really cool comic strip inspired graphics in the upcoming prevention strategist. So keep a lookout for those.
Yeah, shout out to the fall issue of the prevention strategist that will highlight that information. Tammy, what about you? Share some insights and explain deeper about this year's theme.
Well, I do have to say I'm really excited about the different graphics and how IPs are being presented as superheroes. Really excited to see that. But even going farther, besides just the infection preventionist, we also want to make sure, I always say here that infection prevention is a team sport and everyone is involved at every level, and wherever you're at, long-term care, acute care hospitals, everyone is involved and wants to work together to keep our patients safe. So all of these resources are meant to bring everyone together with our one common goal of keeping patients and all our healthcare workers safe.
Absolutely. And, to be something, fun and engaging at the same time, those fresh new materials. So, you've explained a lot about the theme and kind of what's going to be the focus each day. Could you share some of your maybe personal experiences of how you've used International Infection Prevention Week materials in the past, or is there any, key highlights that you would want to share for this year?
Well, I'd love to share a couple of things that we did last year during IIPW that were just huge hits in the hospital. One of them, a lot of people get tired of hearing hand hygiene, hand hygiene, hand hygiene. So we were trying to find a fun way to go and spread that and just explain and show the importance of it. And so we thought, well, let's talk about gloves. A lot of people think, well, if I have gloves on, I can substitute that for hand hygiene. So we took a card around and we had people put on gloves, spray shaving cream on those gloves, rub it around like they were washing their hands or getting those germs all over their gloves. And then we had them take their gloves off and try not to get any shaving cream on them. And no one could do that. And so when they saw that, we were like, what happens when you're going in and you're taking care of a patient and, maybe you get blood and body fluids on those gloves and you take them off, but you don't perform hand hygiene because you're thinking those gloves are a substitute. That was real eye-opening for a lot of people. And then the other thing that we got that was really fun, and that was a theme that was shared with or from the APIC Communications Committee last year, was the Build-A-Bug project. And so we shared that idea with a lot of our different units and departments, and each of them that wanted to participate picked a bug that they wanted to have, and we gave them like a week or two to build these bugs, and then we had it out in a big lobby area where everyone could see them in it. So it had some people did some 3D printing, some people just did posters. So it was really a lot of fun, and everyone got to vote on it, but it was very educational. It kind of shared what their bug was and then how to isolate from it, how to keep from spreading infection. And then we voted on it, and 3 different units got prizes, or won awards, I should say. So we had the leadership vote on one. We had People's Choice where everyone could vote on it. And then we had most educational.
Oh, I love that. And, I bet that, the shaving cream, for sure, it probably made a very memorable experience for some of those healthcare workers, and so when they're taking gloves off in the future, I wonder if they'll kind of think back to that exercise that you had them do and, really remember how important it really is to, practice hand hygiene after the removal of gloves. But it sounds like it was messy. Was it messy?
It was a little bit. There was some shaving cream going. And I did forget to add, when we went out and did this, we blew up white balloons to make soap bubbles. And then we pinned them all over us. So we looked like big soap bubbles.
Oh, that's fantastic. That's fantastic. Michelle, do you have any experiences you'd like to share with us or tips for this upcoming year?
Yeah, I feel like there was one year that I know that we went into, and we actually did this more in an ambulatory setting. So we actually had a nice little hand hygiene station for patients that were coming in. So we used the glow gel to put into their hands and had them put it on their hands and then go into a nearby restroom and to wash it off to see how well that they were able to wash their hands. And we were handing out free hand sanitizer at the time as well. But similar to Tammy, we also did the Build-A-Bug last year, and that was a lot of fun. We had a number of different departments that came in together and selected what bug that they wanted. They selected, we also had a leadership choice, kind of the people's choice, and then the IP choice, which, the most educational. But it was really fun. We had people who crocheted Staph aureus. We had, they created a little mini cruise ship that norovirus had taken over. So It was a lot of fun and really engaging. And that was really something that the APIC Communications put last year as an activity. So that is just an example of how we were able to plug and chug it. And we were able to use it at different sides of the country. So that's really exciting to see.
That's amazing. And of course, I'm taking notes to take back to my facility for this year's IIPW celebration. So thank you for sharing that. And also, of course, APIC offers a lot of volunteer opportunities to us IPs and, strategic partners. And of course, with this deeply meaningful theme of this year, share with us and listeners more about what it means to be a part of the communications committee for you, and what has it meant for you both personally and professionally?
Yeah, so I myself was really unaware of the national committees. So I had volunteered at like a local APIC chapter, and I was on their board there. But it wasn't really until I had a colleague who was on the communications committee who informed me of there is this kind of greater resource out there and where you're able to volunteer. And once I joined, it's amazing what really happens behind the scenes, like not only like putting together this podcast, but some of those, the infographics that come out. It just really opened up my eyes and has really given an opportunity to really, I feel like, make a greater impact than just my local facility, right? I'm always looking for what resources can we create for our members so that we're not all doing the same thing over and over again. I feel like we're often on those IP chat groups and asking like, oh, what about this resource or that? I know that we're all searching on the internet for certain resources, and I love being a part of creating those for our members so that we have something that we can either draw inspiration from or just literally just grab it and take it and run with it.
Thank you. Tammy, what about you?
Well, my story is very similar to Michelle's. I still am active in my local chapter. I was the treasurer for 4 years and my term was coming to an end, but I wanted to stay involved and I was wanting to look more at a national level outside of just my own local chapter. And there were a couple of people on different committees at the APIC level, but nobody on the communications committee. But anyway, I took a look at it and I was like, well, this one sounds exciting because I like doing the education. I like to do creative things. When I saw that the communications committee was actually involved with planning IIPW, that means I was very excited about that. And then as I looked more into it, I was like, wow, there's this podcast and then the different journals that we have. So that's how I got involved in that. And then after meeting everybody, it's been just such a wonderful opportunity, and it's definitely an honor and a privilege to be on this committee. The people that I've got to meet, the ideas that we've got to share, it's a growth experience for me, and it's just been so far a wonderful experience. And I've only been on the committee since January.
And I do want to highlight and shout out the communications committee, as you all definitely are an integral resource to Kelly and myself. And this is also a major opportunity for those that may be interested in the future when the elections or the opportunities are open for volunteers to consider the communications committee, as it's a form of building deeper connections within the IP community and also broadening your knowledge in the IP profession.
I totally agree. And being able to, offer that service, it's just very deeply rewarding. And so I thank you both very much for your commitment in that space. So you've really, run us through a lot of the responsibilities from the communications committee in terms of IIPW. But, for our listeners, what are some of the other exciting initiatives that this committee is working on?
I know one thing that I'm really passionate about and extremely excited about is all of the infographics related to the different bundles. So we already have published, at least at the time of this recording, the CLABSI bundle and a C. diff bundle, as well as essentially an outpatient CLABSI bundle for those who have long-term access and patients who go home with central lines. But there are more bundles in the works that we are collaborating with our practice guidance committee. So hopefully we'll have a CAUTI, a VAP, and an SSI bundle coming out that's based on evidence-based practice, best practices. And I love being able to there's these larger documents that kind of come out that have all these best practices, but it's really hard to distill those and make them really easy to digest. And I love the challenge and producing those things. So I'm really grateful to having the APIC staff here who are able to help with these infographics and really make them nice and crisp, and just these wonderful education tools. that I feel like are just needed.
I agree with Michelle, and I love all the bundles, and then I also love the opportunity to work on our pathogen briefs that we have. Just got done working with another member of the communications team, and we worked on a TB one, not only for infection preventionists, but also for the population as a whole, so that they can read those. And so there will be different ones. There will be one that's more focused from an infection preventionist standpoint, and then one that's more focused for our population. But there's other things besides TB. There's measles, there's Ebola, and we even have one in the works on like tattoo parlors and things. So very exciting to do those pathogen briefs.
Yeah, I think my goal is always like, I want our pictures or like our infographics to be like, if you search any type of for images for any type of, like CLABSI bundle or anything like that, I want our images to come up first. I feel like that's kind of my underlying goal.
And that's a great goal to have. And I know I myself personally am very excited about the initiatives that are forthcoming from the communications committee for my use within my IP practice. And I'm pretty sure the listeners and everyone in this recording are excited about the newly implemented or will be implemented resources coming from this committee. And also just wanting to share that from a call to action to all that are, that can hear us on this podcast, and to all APIC members and strategic partners to stand up for infection prevention and evidence-based practice. Tammy, Michelle, thank you.
Yes, thank you, ladies. I'm so excited to see these excellent resources that you mentioned come to fruition. And thank you so much for your service and all the work you've done to get us ready for IIPW 2025.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.